Hello, everyone. Welcome, welcome, welcome. Happy Sunday, or whichever day you will be watching this on, but we're very, very happy to have you. It is the Diabetes Awareness Month recognition event, courtesy of Caribbean Dreams. My name is Debbie Bissoon, and today we're talking sugar. And I'm talking sugar with some amazing people who are experts in the field because they have to deal with patients, they have to deal with clients who every day have these questions and who are also living with diabetes. So it is my pleasure to introduce to you Dr. Mario Guthrie. You may know him as Mario Evans. He's not wearing that cap today, but he is Dr. Mario Guthrie. Hi, Mario.
Hi, Debbie.
How are you?
I'm good. How are you?
I'm very good. It's good to see you. It's good to be outside, don't
It's
it?
good to be outside, and it's good to be here talking about such an important topic.
Absolutely, for sure. Also joining us on Zoom, we have Kim Rose with us, and I'll tell you some more about Kim in a minute, but I also want to acknowledge her. Kim, can you wave to the audience for me, please, so that they can see you? And we're also joined by the fantastic Natalie Murray as well, who's joining us via Zoom. So let me tell you some more about our guest, because on the Caribbean Dreams page, you would have seen our posts coming up to today. And we've been advertising and telling you that these three fantastic people will be joining us. And so it is very important that we give you some background about their work so you can understand exactly why they're here with us today. So just to tell you that if you didn't know before, Mario Evans, the singer, is also Dr. Mario Guthrie, if you didn't know that, right? I don't know who would know that, right?
They might not know.
They may not know. Let's not take that for granted. But he's trained at the University of the West Indies Mona campus and graduated with honors in anatomy. Tell them what else again?
And obstetrics and gynecology.
Obstetrics and gynecology as well. He has had a work experience in the various hospitals in Kingston, St. Andrew as well, and is currently working as a casualty officer in the accident and emergency department at the Bustamante Hospital for Children. And also, he has his own general practice. Just a wink there. If you need a doctor, you know who to call. Okay, right?
Why not?
And Kim, let me tell you some more about Kim. Now, Kim has a Bachelor of Science in Diabetics at the Florida State University. She has a Bachelor of Science in Exercise Physiology at the Florida State University as well. She's a registered dietitian, nutritionist, and licensed dietitian nutritionist in Florida. She's a certified diabetes care and education specialist. She's a certified nutrition support clinician as well. Kim knows a thing or two about diabetes, if you didn't pick that up before. Okay? So Kim, I'm very happy to speak with you because I'm hoping that you can break this down for us medically and otherwise as well. And we also have Natalie Murray with us. She's a former banker for 16 years. She's now a certified holistic health coach, certified spinning instructor. Natalie, I'm going to call you after this. And she has a Tabata boot camp instructor as well. I don't know what that is, but that sounds intense. What is that?
Tabata is a thing. She'll tell you.
Okay, all right. Natalie, I'm going to need to know some more about that, right? Maury has been helping people change their lives for over 10 years. She recently completed her certification in neurolinguistic programming as well. So welcome, welcome, welcome to our three panelists. And I'll be asking them questions individually about what they do and also about diabetes as well. Now, let me tell you, the stats are alarming. Mario did give a little bit of that in your video online. I did see that. For the persons who don't understand how widespread this is, in Jamaica, let's start here. What are the numbers that we're looking at?
Right, we're looking at about 11.9% of people 15 years old or older having diabetes. And even though 11.9 may sound like a small number, when you look at Jamaica as what? About almost 3 million.
Yeah.
Let's say 10% of that is 300,000 people. Like,
That's
a good number of people, right? More than that. So,
yeah.
it's significant.
Yeah. I want to also tell you guys about the theme for this year. It's World Diabetes Month 2021. It's access to diabetes care, which is very, very, very important. And to give you some history, over 100 years after the discovery of insulin, millions of people with diabetes around the world cannot access the care they need. It is alarming, it's concerning. And people with diabetes require ongoing care and support to manage their condition and avoid complications as well. And we understand, we're talking behind the scenes, Mario, about how quickly this can escalate.
Yeah, man, absolutely.
Yeah.
And
Yeah.
all right, let's start from the top.
Let's
tell
tell
the people what diabetes is. Exactly.
Yes, exactly. So give us the definition in the most simplest way where anybody can understand.
All right. Simply speaking, it's a disease where the body either is not producing the hormone insulin or not responding well to it.
And what is insulin?
And what insulin
Yeah.
does is that it takes sugar and carbohydrates, moves them into the cells of the body, so your body can use it for energy.
Mm-hmm.
So based on the fact that the sugar cannot move into the body to be created, it stays in the blood.
Right.
So it gets elevated and increased. So you have a lot of sugar staying in the blood instead of being utilized and being used. And that's pretty much what's happening. And there are two types. Well, there are three, but type 1 is where usually you have no production of insulin. So those are the people who have to use insulin as a medication, inject themselves.
Right.
And then now type 2 now, it tends to take a longer time to happen. The pancreas burns out a little bit, so the symptoms take a while to develop. And they can take oral medication and or insulin.
Right. We mentioned carbohydrates. And so, diet, even though diabetes can be passed on through generations,
Right.
We also know that its contribution comes from the things that we eat.
Absolutely.
Right.
Absolutely.
So we talk about carbohydrates and what is good sugar and what is bad sugar. Can you break that down? I know, even though Natalie, I think we'll be going into that a little bit later on.
I'm going to let Natalie and Kim touch this.
Yes, but I want you to just tell me now from your own knowledge as a doctor.
Well, again, simply speaking, there's simple sugars like brown sugar
Right.
and white sugar, cane sugar where we eat. That's simple. It gets
Right.
broken down quickly, and there's complex carbs like
Okay.
yam and sweet potato that they take longer to be broken down.
Mm-hmm.
So the ones that get broken down really quickly tend to spike your sugar very quickly.
Mm.
So those can be bad. Sweets,
Okay.
candies, yeah.
Candies.
Yeah. I hope you don't have a sweet tooth.
Half of us,
Yeah, I lost mine.
Yeah, well, I can understand that as well. But so how can one be tested? So I go into the doctor and I say, Doc, I need to know what my sugar level is. How is that tested?
Well, there are some simple blood tests that you can do. Our Ministry of Health likes to use what we call the fasting blood sugar. And by fasting, you haven't eaten anything from the night before, maybe like 10 p.m. So there's like 8 hours that has passed. You come in the morning, we take your sugar.
Mm-hmm.
And we also do what we call a 2-hour oral glucose tolerance test. So we give you some sugar to drink, 75 grams. And then 2 hours after, we draw some more blood again. And we use those two things mainly to diagnose here, as well as something we'll talk about later called the hemoglobin A1C, HbA1c. But we get some results from all of these, and based on the levels, we can determine what's normal, what we call pre-diabetes, which might be a stage right before, and then actual diabetes.
Right. And the other health conditions that can happen or come up because of diabetes, what are they?
Well, you can have complications of diabetes
Right.
because the high levels of sugar cause damage to blood vessels. And that's kind of happening all over the body, affecting what we call our end organs, which would be your major organs, your brain, your heart, your blood vessels. So you can get heart attacks, stroke, blindness, can affect your nerves.
Mm-hmm.
So you can get what we call neuropathy, where you don't feel things, lose sensation and stuff like that. So.
Yeah. Then it's sometimes so alarming when you think about the fact that when you hear somebody say, "Oh, I may have sugar," but not understanding exactly what that means. And for many Jamaicans, it's just a little term to say usually,
Right.
not understanding.
It's just
what
a touch of sugar.
It's a touch of sugar. You know what I mean?
Yeah.
That they don't understand the complications that it really comes with. But
Yeah.
the stories are there of amputations happening as a result. Blindness. I know young people who are, have become blind because of diabetes as well.
And when you're not feeling things in your feet and your
Right.
hands, you can step on things and not know. Then you can get a cut or a wound that you're unaware of for a couple of days that becomes infected,
Right.
which could lead to amputation, as you said. So
Wow. All right. So as I just touched on the fact a while ago that Jamaicans say, we have a little sugar problem. Let's talk about the myths and the misconceptions of diabetes as well. I'm sure you've heard a number of them in your practice.
yeah, absolutely.
Yes.
There are quite a few. One of them is that of the two types of diabetes, type 2 being more common, people think that type 1 only happens in children and type 2 only happens in adults.
Why? Because one sounds less severe?
Well, the one that's type 1 where you may not produce insulin, it tends to happen very quickly and they pick it up, more commonly in children.
Okay.
But it can happen in adults as well and vice versa. You can get type 1 in adults and type 2 in young children as well. And nowadays with our eating habits, we're actually having more younger people being diagnosed.
Mm-hmm. What about the thing where we say we are catch sugar? Like where you can catch something? Can you? No, seriously.
No, it's a good question.
No,
Yeah,
seriously,
yeah.
you know that. Like I see somebody eating a whole heap of candy and you say, "Oh, catch some sugar."
Yeah.
Is that even possible?
Technically, no. And
Okay.
that's because the disease is hereditary. It tends to be linked to family history.
Right.
But what you eat can really help to delay or prevent moving over if you are predisposed. So
Mm.
technically, you cannot catch it like a flu.
Right.
You know what I mean?
Yes.
You probably have a grandmother, a mother, direct relative who has had diabetes and it's in the family line.
Right.
And yeah. So,
Okay.
so yeah, we won't be passing it on like a sneeze.
Right. Right. And symptoms, though, what are some of the things that people can look out for that
Yeah,
would indicate that, I need to see a doctor?
Yeah, that's an excellent question because that's usually what would trigger someone to want to come in and be tested anyway.
Mm-hmm.
Increased thirst is one of them. Increased hunger. Increased urination.
Mario, hold on. Back
When
up
I
for me a
talk like
little
we're
bit,
just
please.
hungry like on a regular
no,
day, and when I talk
no,
lunchtime hunger.
That's what I'm talking. So when they say increased thirst, because Jamaica is a warm place, and so we get very thirsty very fast. What am I looking at? Am I looking like, I wake up in the middle of the night and I just want something to drink, and I'm drinking like gallons of water, and I still can't quench my thirst?
Yes,
Okay.
and when we say increase, we're also thinking more than what you would normally do. So if you know your normal is X, you're now drinking way more than Debbie would normally drink.
Okay.
Passing urine more than Debbie would normally pass. So it seems out of the norm for you.
Right.
Extreme weight loss is one actually too. And the reason for that again is that the sugar is supposed to be going into the cells with the insulin to be used for energy. So if that's not happening, then you can lose weight even though you would think maybe you'd gain, but you actually lose weight. So some diabetics, when they're newly diagnosed, they come in skinny, slim. They've just lost a bag out like 5-10 pounds and they don't know, unexplained.
So the other misconception as well is that we see people who may be overweight and think that they are diabetic.
Yeah, and that's not fair.
Okay.
we shouldn't do that.
But
But
the stigma it carries when you see somebody who may be on on the heavier side, that this person is actually struggling with diabetes and hypertension and all these other things.
well, you know what? There are actually a lot of overweight people who have very normal blood pressures.
Right.
But that being said, obesity and being overweight does contribute to it moving over. And if you lose weight, it can help to prevent and delay. So
Wow.
that's actually one of the important ways to prevent
Mhm.
the movement over into diabetes.
Yeah. Is itching? You mentioned itching a while ago as well.
I didn't say itching,
Okay.
but that can be one. Fatigue
Okay.
is another one. But yeah.
Right. And we're talking about in the extreme cases here. So if your body is itchy a little bit, that don't mean saying it's
No, we're talking extreme. And these would be
Right.
early signs. So the things that a lot of people have that may be considered serious, they tend to happen more long term.
Right.
And those would be like the blindness
Mhm.
and the loss of sensation. Those are more long term. So you'd probably have had diabetes for a long time when you start feeling those things.
Yeah, yeah. But many people, of course, we start looking for cures. So once we hear that there's something out there, just like COVID, we start looking for a cure because we want it to go away.
Wanted to go
We
away.
want it to go away. Let's talk about the cure, if there is any cure
Yeah.
for diabetes.
There is actually no cure
Mm-hmm.
for diabetes, but there are a bunch of medications. And again, in summary, you have tablets, oral medication that you can take, and you have insulin that you can inject, which a lot of Jamaicans don't like. A Jamaican afraid of
We
needle.
don't like needle. We don't like to be picked and
Oh,
pricked.
no, picked and pricked. But the good part about the insulin needle is very, 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 very small.
Mm-hmm.
And the injection is given underneath the skin. So it's not in the muscle. It's called subcutaneous. So you just grab like some of your belly fat and you inject in there.
You make it
And it
sound
sounds easy, right? And
no, Mario, you make it sound good. Like you make it sound like I should be doing this anyways.
like this should be a thing, no? But in all honesty, though, that is actually one of the greatest fears of a diabetic,
Right.
injecting themselves. But once you train them and you counsel them and you explain to them how to do it,
Yeah,
they become empowered and it becomes great for them because they control their sugars and they feel so much better.
yeah, yeah. Let's talk about good sugars.
Good sugars.
Good sugar.
Good sugars. All right.
Good sugar.
So as we had said before, complex carbohydrates would be the better way to go. I tell you, Kim is gonna be the one. She can correct me here.
Yeah.
I'll admit a lot of general practitioners, we know general nutritional stuff,
Yeah.
but sometimes we
But
don't
the
get into the
nutritionist like
details.
Kim is going to
Kim
be
is
able
gonna
to
give you
break
the
it down and
details.
tell us what it looks like.
But broadly
Yeah.
speaking, complex carbohydrates are definitely the better way to go than simple sugar.
Mhm.
So yeah,
Okay.
so your yam and your banana and those things. But you still have to be careful with them though. And Kim and Natalie will talk about moderation.
Right, right, which is very, very important because in all things, balance is key. Balance is key. All right, so what should my blood sugar be?
Right.
Yeah. How
Yeah.
can I tell if I have a healthy blood sugar level?
Well, we have to test. And you don't always have to draw blood from the vein and send it to the lab. We have this nice machine called a glucometer where you can get an immediate reading, and everyone should have one, but especially every diabetic should have one. And it depends on when you're taking the reading. So if it's a fasting reading, we have certain numbers that we look for. For example, we have this nice one behind here.
Yes.
So we have a fasting range. So some machines read in milligrams per deciliter, which show these big numbers, and some machines read in millimoles per liter. And those are the units, the measurements. So this is milligrams per deciliter, and this is an example. You expect your fasting blood sugar to be in the 0 to 100 range. So when you do the finger prick test with the glucometer, a number pops up on the screen, and it will be one of these numbers. And we want your fasting sugar to be here. Yeah. If you just had a meal, here, and if you just finished a meal, here.
Okay, the 120 to 140.
The 120 to 140, and these would be in normal ranges, right?
And when it's not in normal range?
When it's not in normal range, if it's greater than 11.1 millimoles per liter. So if I had a glucometer now and I stick you, Debbie, and you got a 11.1 or more, that would be millimoles per liter. That would be suggestive of diabetes for you. And I would want to further test you to make sure that you're not diabetic.
Some ways I'm happy.
I don't have a glucometer, and in other ways you should be happy. I should have brought it.
You should have brought it, because I wouldn't have mind doing a live testing right here.
Wow.
No, seriously,
could have done
it would
right?
have been good. It would have been good to know, because you need to know.
And I don't carry it in my car.
And that's what I wanted to ask you. So if it's a case where I don't have all these symptoms, should I be testing it regularly anyways? Like,
technically, no. And there is a screening age that the American Diabetes Association recommends. If you don't have first degree relatives who are diabetic, they actually say 45. But that being said, once you turn adult, and especially if you are obese, overweight, you should check.
Right.
If you start doing executive medicals annually with your general practitioner, you'll pick up on these things, right? So I would say definitely you should check.
Okay. All right. I want to ask you something else before I move on.
Yeah,
where can we get access to care? Because this is the other part of it where, along with the theme, it does say that care is actually a big problem.
Yeah.
What is the reality here in Jamaica? What are we looking at?
The reality here is good. We have lots of access points. And by that I mean we have our government health centers, we have general practitioners like myself, and we have the Diabetes Association of Jamaica, and they offer multiple services in one place.
Yeah.
So there are days when you can go in and see an endocrinologist, who would be the person who is a specialist. And you can see a podiatrist, which would be your foot doctor. You can see a nutritionist, like we have Kim. And you can actually get diabetes education, all at the DAJ.
Yeah.
On Downer Avenue.
Okay.
So a good place to go.
Well, there we go. Thank you so much, Dr. Guthrie. I'm going to bring in Kim here in the conversation. Hi, Kim. Kim, we're not hearing you. Can you unmute your microphone? And I want to say hello to everybody who's joining us on YouTube. I see Shavani Sinclair, Andrea Baines, and Dorian Sterling. I see some persons there in the chat. Please stay with us because I have some things to give away. I hope we can still do them if we have time. Kim, can you hear me now? I think she can hear me, but I can't hear her just yet. Let's see if we can get Kim here. Mary, let me ask you something though.
Yeah, while we wait for Kim.
While we wait on Kimberly, I want to ask you about I think it's, let me see here. It's A1C. When I saw this A1C,
like, what is that?
What is that? Yeah.
It's called a hemoglobin A1C, and it's the test that we commonly use to monitor someone who is already diabetic. And how it works, it shows you what your blood sugar is 3 months prior to when it's done. So it's giving you almost like a 3-month history. So how I can break that down is, let's say you're diabetic, you come to my office. The morning you come, you take your medication, your sugar look nice when I do the glucometer. And I do your A1C, but the A1C is off the chart. What that's communicating to me is that you haven't been as good with taking your medication over the past 3 months, even though you've come in and impressed me today. So it gives you a more long-term monitoring effect, and that can be really good because you want it to be below 6.5%. It's notated as a percentage, and you want it to be below 7. Okay. And some people use 6.5, and that's how you know you're controlling yourself well.
Okay. Talking about control, I'm going to bring in Kim here. Kim, the diabetic expert. Kim, tell us about that. What qualifies Kim to be a diabetic expert? What does that look like?
That is a very good question, baby. So, as a diabetic expert, I went to school for a minimum of 5 years. So the first 4 years was strictly about food, nutrition, anatomy, physiology, microbiology, physics, so forth and so on. So then after I was done with my initial schooling, I received an internship with the United States government to work in their hospitals to specifically treat individuals that had a variety of different ailments. So after that, you take an examination and then you are qualified to practice as a dietitian nutritionist.
Wow. Sounds pretty intense. It sounds like a lot of hard work over a long time. We're very happy that you decided to focus on that. And talking about focus, why did you decide to focus on persons with type 2 diabetes and persons who were pre-diabetic?
You know, to be honest with you, Debbie, it's because of my family. I had an uncle who, at the age of 45 years old, got diabetes. And because he was eating up a lot of the simple carbohydrates, the banana, not excuse me, not the banana, but the dumpling and the white rice and the sugar and the soda and the box juices, he ended up with diabetic complications. And by the time he was 54, he had died due to diabetic complications. But when I saw that this could easily be controlled through diet, lifestyle, and medications, I said to myself, as someone from the Caribbean and practicing in the United States and seeing the Jamaican diaspora as a whole suffering from uncontrolled diabetes, I decided, you know what, I wanted to make a difference.
Let me tell you, I mean, I can totally relate, having had, family members. I still do have family members who are living with diabetes as well. My mommy, I was telling Maria earlier on that she does now live with type 2 diabetes, and I saw her when she was pregnant with my sister go through gestational diabetes and she had to prick herself every day with insulin. And one of the biggest contributors I find for her spike has been the food that she would eat. And you mentioned some food groups there and some types of food that a lot of people get concerned about, because if I'm going to cut those things out, I'm cutting out all of my food. White rice, dumpling. Those things are traditionally part of the Jamaican plate, right? And when you tell them to eat anything else,
Right.
you start running for the hills and start feeling overwhelmed, right? So how does one start now with this change in diet to have a handle over diabetes?
You know, I'm so happy that you mentioned that, Debbie, because to be honest with you, certain foods do not need to be cut out of the diet. The problem is how much we are consuming. So let's first start off with something that Dr. Guthrie said. He mentioned simple carbohydrates as well as complex carbohydrates. So simple carbohydrates include such things as soda and sugar and even dairy products. And when we consume these things, they send the blood sugar levels spiking sky high. Complex carbohydrates now are a little different because they are filled with fiber. I'm speaking about banana, yam, brown provision, brown rice, brown pasta. These foods also increase your blood sugar levels, but they also have fiber in it. So what I like to tell people is you can still enjoy the foods that you like, but number one, make sure you know the portion size for your carbohydrates, which is the size of your palm, and also take care of that.
Hold on. Kim, a lot of people are going to say, is that
Yeah.
a little bit of food that my belly is not going to be full with that amount, right? But is that the portion
Right.
size for everything on my plate, or is it just for the carbohydrates?
Just for the carbohydrates, because that is the food category that spikes your blood sugar. So now with the protein and with the non-starchy vegetables, such as the callaloo, cabbage, spinach, you can have more of that because it's not going to bother the blood sugar levels.
Okay. That is good to know.
Absolutely.
That is good to know. Now we can have some kind of imagery of what my plate should look like. And so if I have dumpling, banana, yam, and dasheen,
It's gonna be a
and piece of
powerful.
cocoa, and is that
Yeah.
too much on the plate?
As long as it's
Way too much.
Way too much on the plate.
As long as it's in the palm. Yes.
Well, okay. Kim, if I've been diagnosed with diabetes, what should my plate look like?
Good question. So half of the plate is non-starchy vegetables. So again, that's the cabbage, the callaloo, the salad, and I personally don't care if it's raw or cooked because fiber just has a positive effect on blood sugar levels. 1/4 of your plate should be the protein, and that protein should be grilled, jerked, or baked. I understand that fried chicken tastes really good, but something that we need to remember is that individuals that do have diabetes have a higher risk of heart condition. So that's why I said try to bake it, grill it, or jerk it. And with the vegetables as well as the protein, there is really no restriction in the amount. So you can really eat your full. But the portion that you need to be careful of is the carbohydrate. And again, that 1/3 section, which is the size of your palm, should be your ground food, or your rice, or your corn, or your brown pasta, or any of those complex carbohydrates.
Okay. All right. Well, that is very, very good to know. The other thing is, I'm sure this has been around for a while, but I think the awareness of it has increased, is these special diets that are all around the place. Are there any that we should avoid? You without calling any names, but you can tell us what it entails, and so we'll kind of have an idea of what you're talking about. Are there any out there that we should be staying away from?
Yes, there, without calling any names. So that's going to be hard for me to do. So I'm just going to try to describe it.
Yes, try.
Part of my existence, the bane of my existence. So certain types of diets that tell you to cut out an entire food group should not be followed. And one of those diets really like to demonize carbohydrates. A lot of people don't realize that carbohydrates are full of vitamins and minerals and B vitamins, which is important for DNA and the overall functioning of the body. So if anybody says, they can't eat any type of starch, they can't eat any type of carbohydrate, run, because they are incorrect. Another thing as well is I realize that a lot of people try to minimize or even cut out fat from their diet. Now I know you guys may be thinking to yourself, all right, Kim, what do you mean by fat? So in moderation, fat is important because it allows us to make hormones. It keeps our internal organs cushioned. The problem is right now in the 21st century, we consume too much fat. So what I like to tell people is get their fat from plant-based sources, such as pear or avocado, coconut, nuts, seeds, as well as plant-based oils. So again, the main take-home point is do not cut out any food group. These different foods have different vitamins and minerals and are needed in the body in certain amounts so it can function normally.
Yes, so rather find a balance versus taking it out entirely. Yeah.
Correct.
As you mentioned fat, so you say get the fat from plant-based food, but what if I've had, my chicken, my fried chicken, and with a piece of pear? Mario, don't look at me like that, because I know, a lot of Jamaicans cannot relate. I have a piece of my fried chicken, my leg and thigh, with a piece of, one piece of chicken don't work for us Jamaicans. A slice of pear, and then I'm gonna have my carbohydrates on the plate as well. And just as an extra piece of food, I'm gonna have a handful of peanuts along the way. Is that too much fat in one meal?
No, it is not too much fat in one meal. Let me tell you why. Because the peanuts also have fiber in it, and they also have plant-based protein. So really, what I would tell someone to do, I don't function from the law of subtraction. I always function from the law of addition. So I always say, what else can you add to the plate to make it balanced? So adding the peanuts will add fiber. So that is the only thing that is missing from the pear, the fried chicken. You actually need a little more fiber.
Yeah, yeah. All right. I thank you so much for that clarity. I want to get into the weight loss process now. If it's difficult for me to lose weight, what should I be doing? I've tried my special diet, and for whatever reason, the weight is going nowhere. The only thing left for me to do is just to fast 40 days and 40 nights, and, let's see what happens on the 41st day. What should I be doing, Kim? What am I doing wrong? What's causing me to not be dropping those pounds?
Well, there's actually a few different reasons, Debbie. So a lot of people think if they have diabetes, it's just about the food that they eat, when there's actually three other reasons why someone may not be losing weight. Number one, stress. Because when we are stressed, this causes a lot of stress hormones to be elevated that causes us to keep our weight. Number two, sleep. If we are not getting adequate rest, then our body holds on to the fat. Number three, exercise. We need to make sure that we are intentionally exercising. So I know some people say, well, I'm on my feet all day. That is not intentional exercise. We need to make sure that we are doing some resistance training with some weights or even running to help our metabolism increase. So those three things will help with weight management with diabetes.
Okay. All right. I'm going to bring us now to the packages, the food labels that we find on our shelves. And for a lot of us, we don't want to read it. We don't understand what it means. It's a whole heap of numbers and kilograms and, things to pay attention to, and serving size. And in one thing, I had to, I'm going to get a little personal here. Maria had to explain to mommy, who was enjoying a soda one day. I said to her, you can't have the whole bottle of soda. She said, why? I said, in one bottle of soda, there's 3 servings. And in each servings, there is 36 grams of sugar. Right? Let's talk about the importance, Kim, of looking at that label and understanding really what it means and the difference between the sugar that's inside it and when it says added sugar. Yeah.
Very good question. So let me start off by this, a clarification, because a lot of people, when they look at the nutrition facts label, they tend to look at sugar. But sugar does not tell you the full story. Looking at the carbohydrates tell you the full story. There's a reason why the word carbohydrates is bolded on the nutrition facts label, because it takes into consideration the sugar as well as the added sugar. So sugar is normally found in foods that are sweet, such as milk. Milk has naturally occurring sugar in it. Added sugar now would be if you add an additional outside source of sugar, such as syrup or even brown sugar or white sugar. So when you're looking at the nutrition facts label, first look at carbohydrates, because that tells you the whole entire story. Next, look at added sugar, because then you can see how much sugar did they add during the processing process. And then you want to look at the total sugars, which are the naturally occurring sugars. But just to really simplify everything, we want to make sure we're looking at total carbohydrates, because that tells the full story.
Wow. Wow. And then it's that total carbohydrate per serving or per the entire package?
Per serving. Per serving. So if that soda is 1/4 cup.
That is alarming, Kim. That is, I'm thinking about everything I've placed inside my body from last night to this morning. And I've lost count. I've literally lost count, seriously. And I can know a lot of Jamaicans are saying, boy, me I tell you about that sugar gone in my body from last night to this morning. That's very interesting. I did not know that, Kim. Thank you for that.
Oh, my pleasure. My pleasure.
Yeah. So okay, I have a sugar craving and I need to be aware of the amount of sugar I'm having. Kim, what can I substitute, let's say, a bar of chocolate for?
Ooh, that's a tough one. That is a very tough one. So this is what I like to tell people. If you're having a craving, it is best to pay attention to your craving and not ignore it. The reason being is because if you ignore it, you end up binging. So I would rather have the person have a small serving of chocolate rather than the whole entire bar. So if you're having a sugar craving, ask yourself these questions. Number one, am I thirsty? Because a lot of people really confuse dehydration for a sugar craving. Number two, am I hungry? When was the last time that I ate? If you ate more than 4 hours ago, then you need to eat something, and then afterwards you can have a very small portion of a chocolate or even an unsweetened chocolate. So those are the main two questions that you need to ask yourself if you're having a sugar craving. Because a lot of times, to be honest with you, Debbie, I have seen countless people throughout the Caribbean diaspora that come to me and say, well, my doctor told me I can't eat this and I can't eat that. So what am I going to eat? And they end up failing. So I teach people instead, look at the carbohydrates, find out what is your specific allowance and try to fit that in while focusing on the nutrient-rich foods such as the fiber, the healthy fats, and the lean protein.
Yeah, yeah. I want to bring in, because you're a nutritionist, Kim, and I want to bring in the other types of, I wouldn't say medications, but there are things that we can actually use that will help us to manage our sugar levels, like cinnamon and cinnamon tea. Yeah. A lot of people may not know that cinnamon tea is actually good for that.
It is. Cinnamon tea, research is showing that it has a very positive effect on sugar levels. In other words, this may mean that it can bring down your blood sugar. So what I like to tell people is one of the greatest offenders of spiking your blood sugar is the beverages that you drink, such as the boxed juice and the soda and anything sweetened with any syrup. So ginger as well as cinnamon has been showing to improve the blood sugar levels. So that's why honestly I have some Caribbean dreams, ginger tea as well as some cinnamon tea in my kitchen, and that is something that I sip on because I know diabetes runs in my family, so I have to be careful of really decreasing my risk of not catching it.
Yeah, yeah, seems. And I thank you so much for pointing out that the cinnamon and ginger as well is actually good. And my shameless plug is that Caribbean Dreams carries both. So
Yes.
they carry both. And Kim, if I'm to visit a nutritionist, what am I to expect from my conversation with the nutritionist, and what should I be telling my nutritionist?
Well, number one, realize that a nutritionist is not the food police. We are not here to shame you. We are not here to judge you. We are here to help you reach your blood sugar goals. So something that I find helpful is knowing what exactly you're eating and the times that you're eating. So before you go to see a nutritionist, I would really encourage you to record everything that you're eating and drinking 3 days prior so that the nutritionist can look through your log and help you make modifications.
Absolutely. Thank you so much, Kim Rose. I think Kim has given us a listen, a lot of information there to consider. And I thank you for breaking it down in understandable, practical ways that I think we can all employ and now be aware of the things that we're actually putting into our bodies so we can manage our sugar levels daily.
Yes.
I'm going to bring in Natalie Murray here. Natalie, whew, after I've gotten my diet right, my doctor says, Debbie, you need to, get active.
Get active.
Get active.
Do some Tabata, whatever.
Do some
We'll
Tabata.
find out
I
soon.
need to find out from Natalie what is Tabata. Natalie, I want to ask you, do I need a health coach? What point should I say to myself, okay, Debs, you're losing it now. You need a health coach.
So a health coach is sorry, there's a feedback I'm hearing. Okay, so a health coach is really good to help you figure out how to actually implement some of the changes that you are told by your doctor or your nutritionist to make. So we help to provide accountability. We also help to guide you on those small diet and lifestyle changes. So you would sit down with a health coach if the doctor has said to you that you are pre-diabetic and we don't want to tip the scales and get there, or you've got a family history of diabetes, and you definitely want to make sure that you don't live your life in ways that will manifest that disease.
Ah, okay, okay. Love that. What's the difference between a clinical nutritionist and a health coach?
So a clinical nutritionist, someone like Kim, is going to talk to you about the very specific things that she was speaking about, giving you the grams that you should be eating, the grams of carbs. She and I actually are so aligned on so many levels. It was phenomenal to hear what she was talking about, because I think a lot of the nutritionists that I've come across don't address the lifestyle factors that Kim mentioned, such as the sleep and the stress and the exercise. So to hear that she incorporates that in her practice is phenomenal. The main difference is that she's licensed to work in a hospital setting, and she's licensed to work with people that are on medication. Whereas I have the awareness and the training, I would certainly not put myself out there as I'm going to work with you to reduce your medication. So I would more be called in at the preliminary stages, or if someone like Kim has outlined what your macros should look like and you're having difficulty implementing it in real life, this is where I can come in. So you're like, boy, Natalie, I just can't figure out. Kim said I can't eat more than X. I don't know what to eat that fits me in that space. Or I'm so stressed out, the kids, the this, the work, the whatever, I can't figure out how to actually cook my meals at home. This is where I can come in and help strategize with you on some real life examples.
Okay.
As to how to implement.
And a holistic health coach is one that will take into consideration.
Boy, holistic means your emotional well-being, your financial well-being, your relationships, your spirituality, how much joy you've infused in your life. Like, we look at the whole person, because again, as Kim rightly touched on, just because you're craving sugar does not necessarily mean that you need sugar. It could be that you're feeling unfulfilled, or you just had a horrible day at work and you're stressed and you're tired and you're overwhelmed. And sugar has an opioid-like response in the brain. So the same pleasure centers that light up with illicit drugs light up when you take sugar. So sugar makes you feel good. And a lot of people have conditioned themselves that when something bad happens or a stressful situation arises, that they turn to sugar to feel better. So I'll help to identify those and then strategize around how do we find other ways of coping with the challenges of life other than drowning your sorrows in a tub of ice cream.
Yeah, very important. All right, so I see this question that's written here. I didn't hear you say it, but I'm going to read it how the question is phrased. It said that you made a statement saying that diabetes is contagious. What did you mean by that? I didn't hear you say that, but tell me why you would say something like that.
Yep, it's actually up on my Instagram page, and I did it as a thought-provoking exercise. So, as Mario said in the beginning, as Dr. Guthrie said in the beginning, you're not going to catch diabetes by somebody sneezing on you, and you catch it like a common cold, or we tend to think of things as contagious. But if you broaden the definition of contagious and look at who do you hang out with, who do you spend time with, and recognize the fact that you do what your friends do and your friends do what you do. Let's go out and drink. Let's go out and have beer, pizza, and chicken wings. Let's go, let's just lie around and eat popcorn and watch TV, right? So you do what your friends do. You also do what your family does, and you eat what your family has eaten. So if mom showed love by making you like amazing sweet potato pie, sweet potato pudding, right? You're eating the same way that your family has always eaten, right? So it's hereditary and it's contagious from a food choice.
So you just, and right now around my Thanksgiving dinner table, I'm going to be there freeing everybody because, when you get that candied sweet potato, okay, do not eat that. Let's not do that. Yeah, Christmas is going to be very difficult for me with this. Let's talk about pre-diabetes though, because I see here that you've helped persons with pre-diabetes. What measures would they take for it not getting worse? And what is that? I didn't remember asking that, Mario. Could 1 second? Let me just have the doctor's opinion here and tell us what is pre-diabetes.
Right. Pre-diabetes is when your blood glucose levels are higher, your blood sugar levels are higher than normal, but not quite yet diabetic. So it is that in-between phase, I call it.
Right.
And it is a good phase in that you can delay and prevent moving over to diabetes. So it's good to catch it because you can really intervene at that point.
Right. And that's a delicate place to be, right, Natalie? Because, it's now about not allowing it to get any further.
Right. So we can look at lifestyle issues. Controlling stress is very important. We can look at the dietary issues, such as making sure that you get adequate fiber. As a matter of fact, aiming for fiber. So I like to encourage people to download an app that they can use to track, and not to get obsessive about it, but certainly for a few days or so, just enter the foods that you eat in the app and see how much fiber are you actually getting, because a lot of us do not get adequate fiber. So if you are pre-diabetic, focusing on upping your fiber intake will naturally crowd out those simple sugars, like the liquid sugars, like juice and sodas, that really are detracting. So if we can increase the nutrient-dense, fiber-dense foods and reduce the free-flowing sugars that are not necessary, then that's definitely one thing that we can do. Another very important thing that we can do is to introduce exercise. So both resistance training and cardiovascular training, just 4 hours a week of moderate to vigorous exercise has been shown to improve your blood glucose levels by 40%. Right? So this can be even walking, as long as it's brisk walking. So we're not talking about strolling the supermarket. We're talking about focus, dedicated, get the heart rate up into a target zone of about 75 to 85% of your maximum. Tabata is something that you can do, which is just a high intensity interval routine where you're exercising vigorously for 20 seconds and resting only for 10, and you do 8 rounds of that. So it's a 4-minute drill. Incorporating something like that into your exercise routine would also help to improve your glucose levels. And then doing things to bring down your stress levels, because the stress hormone, which we know as cortisol, has a negative relationship with insulin. Mm-hmm. So when you have high levels of cortisol, you are impairing your insulin secretion, and you are also increasing your hepatic or your liver's output of glucose. Because if you think about stress in maybe a traditional sense, if something is stressing you, there is a sense of urgency, there's danger, you want to run away, right? You need glucose in your bloodstream to be able to have the energy to run away. So you're going to want to you're going to want to produce more of the glucose from your liver, and you're going to want to not take it into the blood to the muscles, right? So you're going to want to have that. So stress is a big thing. So deep breathing, yoga, meditation, going for a massage, trying to manage the stressors of life to bring down stress, all go towards moving that needle away from diabetes.
Blocking people on social media as well, maybe.
I'm here for that.
I just want to make sure that that's a stress coping mechanism as well,
Set boundaries.
Setting boundaries.
Set those boundaries.
Exactly. That is a good way to say it. Right. Setting boundaries for sure. Let's talk about the natural remedies now for maintaining a healthy blood sugar level. The things that we can actually look to in the natural world.
So from a supplement perspective,
ginger, yeah.
Absolutely. As well as I would bring in turmeric, because turmeric is a very strong, powerful anti-inflammatory agent. Your omega-3 fatty acids are very important. So is magnesium and vitamin D. We tend to see that those levels are lower in diabetics, and diabetics have a greater demand for them. There's also an antioxidant known as alpha lipoic acid, which is shown to improve sensitivity to insulin. And by the way, this is not a prescription of any sort for you to run out and go do these things. These are things that is to create awareness for you then to talk to your professional that you work with. But other supplements that we can look at are things like chromium and biotin, both of which are shown to improve insulin sensitivity.
Yeah. And for persons who may be living with diabetes and thinking that they are very overwhelmed by the process, the day-to-day requirements that it may ask of them, and living, a stress-free lifestyle. How do you balance that? And I mean, how do you find, I don't want to say the silver lining or the end of the rainbow, the pot of gold in the whole situation, but it's just kind of coming to terms with what's happening with you and find some peace with it.
Yeah. So I find that finding that person with whom you feel comfortable enough to develop a rapport and to share the challenges that you're experiencing and going through is very important. And very often that's the role that a health coach can provide. So in a safe, non-judgmental space, we can hear the challenges, we can hear the concerns, and we can provide the conversation that lights the way forward. Just a few evenings ago, I sat down with one such person who was holding back tears because she's recently diagnosed, had gone through rapid weight loss, and was scared. So very often, when you're going through a situation like this, advice comes at you from all over, right? And it can be very overwhelming. So saying to yourself, I'm just going to find one or two people that I can talk to that I trust, that are going to listen to me in a non-judgmental and an encouraging way and an accountability type way, is way better than over-diagnosing with Dr. Google and seeking out too much information, because that information overload in and of itself can be stressful.
Yeah, very important. I'm very happy you touched on that. Mario, the funny thing is we've been talking about blood sugar levels and in the higher range.
Right.
Is it dangerous when it gets too low?
Absolutely. And there is what we call hypoglycemia, and that's HYPO. So most times when you hear hyper in medicine, it is plenty. Or we hear hypo, it is low.
Okay.
So 3.9 millimoles per liter. If your blood sugar falls below that, is considered low. If it's less than 3 millimoles per liter, intervention is necessary. And why it's important is that when your blood sugars fall, you don't get enough sugar going to the brain.
Mm-hmm.
So you can literally go into a coma, you can faint, you can, and you do, so sugar is important for energy. So you literally can go into and comas go, but the comas go when you have a high sugar too, you can go into a diabetic coma.
Wow.
But you can have a hypoglycemic coma as well too.
And if I get dizzy and that
dizziness,
kind of thing,
sweating. So you need to actually, that's the only one time you probably want to have some simple sugars on you actually, because that will bring it back up. If it's not real sugar, it won't. So
and it means I would have not been eating, for a while, or
it could be from not eating. But in the case of a diabetic, they take medications that lower their sugar. So in some instances, they may have taken medication and not had enough food to eat, or taken too much accidentally, and it brought their sugars too low. So definitely something to look out.
All right. Well, wow. A lot of information there. Whole heap of information from Mario and Natalie. And, Kim as well, giving us some good information. And I see the comments online. Persons are saying, thanks for the information. Shavni Sinclair saying, thanks for the information. Maxine Lewis is asking, should I eat the coconut? Kim, should she be eating the coconut? I think you did mention coconut there.
Yes. If she have the coconut as a drops, no, don't eat it like that.
Right,
but if you incorporate it, yes.
Don't say that.
But
you know, eat the coconut drops as a drops.
Drops. But if you incorporate, but if you can incorporate the coconut, the milk into like a soup or even your rice and peas, then yes, that is fine.
Kim, can I ask you a question? What do diabetics who have cravings do? I know we mentioned substitution, but in a real world, what if I'm diabetic and I want some ice cream? Or I want a little piece of mango?
Mario, yes.
Or what do I do?
portion control. Because my
Right.
thing is, I never tell people to stop eating the foods they like. Because everything, this is what I always say, food should not taste like cardboard and sadness. We eat because it's a form of entertainment, it's a form of nourishment. So if you want a piece of mango, yes, you can have a piece of Julie mango or whatever East Indian, whatever type of mango you like. What
Right.
I will say is incorporate it into a meal. Don't just have the mango by itself because you're more prone at that time to overeat. Or if you really want like a piece of pudding, then yes, you can have a piece of pudding. It's all about portion control and eating it after you have consumed the fiber and the healthy fats and the protein, which help to slow down blood sugar spikes.
Yeah.
Right.
And then for the Christmas holidays now coming up,
What we are gonna
how
do?
much is too much? Is the third glass of sorrel too much?
Well, what is in the sorrel? If wine is in the sorrel, wine actually causes your blood sugar levels to dip.
Oh, does it?
So it does.
Not bad.
My thing is what is in the sorrel. So a third glass of sorrel. Well, I would also encourage people to space out their meals. So
Right.
it's not an all day grazing. I don't want people to sit there and graze and snack because this send the blood sugar levels flying sky high. Instead,
Yeah.
don't be afraid to take some home, have it for breakfast the next day, or lunch, or dinner. So it's really about portion control. I think that's what we need to really focus on. It's not so much, yes, it's about the foods that you eat, but the next biggest problem is portion size.
Yeah. Don't eat it all at once. It's good and it's yummy, and that cake is very nice.
Right.
Oh gosh, especially when the auntie who you don't see from long time bake it, but but don't eat it all at once. So this part of the program is a panel discussion, and I mentioned earlier on that my own personal experience with diabetes is actually having my mommy living with diabetes and seeing her go through gestational diabetes, having my grandmother living with diabetes as well, and so this is something that I know runs in my family. And since I've been younger, we say younger, I've tried to make an effort to just balance uh, the amount of sugar I would take within a day. And so I drink a lot of water. I would drink more than probably more than 8 bottles of water per day. But that has been my relationship, yes, with diabetes. And I can see it can be a very costly journey,
Absolutely.
monetarily and otherwise. Um, but Mario, you have had your own experience as well from a family level as well with diabetes, right?
Yeah, absolutely. I have my maternal grandmother
Yeah.
actually died from complications of diabetes. She had a cat scratch, and that's how it started. And the wound got infected. I believe she went back home, but eventually that led to amputation.
Hmm.
But in the long run, she died from complications. I have aunts and uncles who are also diabetic, so it runs in my family as well. So I exercise a lot. I try to eat as best as I can, and I monitor. So I do executive medicals. You know these things.
How often do you do that?
Most people do it annually, and you can actually see a trend and a pattern. Because that's everything in medicine is trends and patterns. So maybe this year my blood sugar is X. I want to see what it is next year. I want to see if it's trending up or it's trending down. So that if I become pre-diabetic, I can call up Kim and Natalie and say, what do I need to do?
Yeah.
So I would say annually if you are low risk.
Right. And my number, in what region would I be looking at to determine whether or not I'm pre-diabetic?
Right. So again, it depends on which one of the sugar tests you're doing.
Right.
But if it is the random blood sugar, then you would want to be 7.7, 11.1. That's if I just pricked you right now.
Mhm.
You should be, in between there would be the pre-diabetic range.
Yeah. Yeah. Kim, you had your experiences as well with diabetes, your family. Can you tell us some more about your experience?
Sure, definitely. So, type 2 diabetes runs very heavily on my mother's side of family. As a matter of fact, the majority of individuals on my mother's side of family have diabetes. And because of excess sugar intake, a lack of physical activity, high stress levels, living overseas, this just made the diabetes complications even worse. So, I realize as well in the area that I'm currently located in Florida, there is not a diabetes expert. So that's, really what led me to really focus in diabetes. So, I also, just like Mario and also Natalie, Tabata, that is my thing. Let me tell you, that is my thing. Because when you're really stressing on exercising those muscles, it helps to bring down the blood sugar levels. So I know people listening may say, well, you know what, this is complicated. I don't know where to start. Really, start where you can. If you can start exercising, start exercising. Because again, the family history of diabetes, if you know someone that has it, or if you have it in your family, you really have to be mindful of how you eat as well as live.
Yeah, yeah. Natalie, as well, I know you have your own experience as well with diabetes. Can you share with us? Are you hearing me, Natalie?
Oh, I can hear you now. What did
Okay,
you say?
yes.
Sorry,
I was
Debbie?
saying that you've had your own experience with diabetes in your family, I believe. Do you mind sharing your experience as well
Yeah,
with us?
I
Yeah.
lost my mom 7 years ago to the complications of diabetes. She developed diabetes, gestational diabetes, when she was pregnant with my sister. And therefore, for 35 years, 38 years, we watched her go through all the challenges that Mario mentioned at the beginning: the neuropathy, the retinopathy, the gastroparesis, the mood changes, which, what a lot of people don't realize is that people with diabetes have a higher depression rate and a higher anxiety level. So there was a lot that we witnessed firsthand, and my experience with mom really propelled me into wanting to help people prevent and, where possible, reverse the onset of this disease.
Yeah. Wow. My condolences to you, Natalie. I mean, for losing your mommy. But I'm very happy that you were able to find purpose in that experience and know you can help so many of us to understand it a little bit better
Yeah.
and manage it. Mario, you wanted to say something
I
about
wanted to touch on the mental
yeah,
health
the mental
aspect,
health
and
aspect.
it's huge. I see a lot of newly diagnosed and even diabetics who have had it for years, and they really struggle with the transition. And can you imagine, culturally, we grew up eating oxtail, and I want to use oxtail. So sugar-wise, we eat a lot of things that technically would have sugars in it,
Mm-hmm.
and then now you have to move to this very restricted diet with things fitting in palm middle. It's rough,
Yeah.
and not only just the dietary changes, but the people around, are eating things that you cannot eat. As Natalie said, is contagious. It's difficult, and I see people go through highs and lows, depression, anxiety,
Yeah.
and it's serious.
It is. It absolutely is, for sure. Because I mean, when I've had to deal with my mommy as well. In trying to allow her to find a balance. Yes, but putting it upon her to kind of take personal responsibility and accountability to the things that she would eat. The family is very sometimes hard and strict on her. Mommy, don't eat it. I can't eat that. And then she's like, but I want to eat it, and I see somebody else eating it, especially mango time. I was about to ask you, Mary, if you see an influx during any particular time of the year with persons coming in and testing.
No, mango time is
Mango
a rough time for
time.
Jamaicans.
Exactly, at Christmas
because they
time.
can't resist. At Christmas, they cannot tell themselves.
I trust me, I can totally understand. And I'm very happy you touched on the point, Natalie, about depression and anxiety, because that may be happening and you don't know what's contributing to it, but it's just happening,
And especially if you are having difficulty controlling it, because sometimes people are trying really
Yeah.
hard,
Yeah.
and they're just unable to
Yeah.
break through.
Yeah. Let's touch on the health, the financial side of it. So health insurance, it's always good to have health insurance. Full stop.
Always.
Always good to have health insurance. Doc, you can tell me about the cost aspect of it, about how costly can diabetes get?
I mean, extensive, and basically, if you link the complications to the disease, then in essence, any of the things that you can get as a complication will lead to something further.
Yeah.
So, if you have a heart event, then you could have to go and do an angioplasty or a bypass or something. If you have a kidney problem, you could have dialysis. So when you're looking at it in a spectrum, the worse things get, the more money you're going to be spending to try and rectify the problem.
Yeah. Yeah. Natalie, when your family got the diagnosis from your mommy, that she now has diabetes, what was that experience like with now understanding what that would mean ultimately, not just for her, but for the entire family, because it does impact everybody, what you usually would be shopping for and all these things, right?
Yeah, it really does. And it's important for everybody to get on the bandwagon and for everybody to be aligned, because as someone, I forget who just a while ago, if everybody around you is eating something and you are not, then you feel left out. And if diabetes runs in the family, then if one of you has to make a change, it's really supportive and also beneficial for you all to make that change, just in the spirit of support, and also for prevention of yourself. Also, exercising together becomes like really a really good thing, because one thing for, oh, I have to go out and exercise, but if we're all doing it together and it's a nice family event, then we're just encouraging good living, supporting and doing the things that we all need to do together to take care of our health. One thing that we did not understand, and a lot of us learned after, is the mental impact of diabetes on our moms. So one thing to know, that the depression and anxiety is heightened, but one of the complications that goes along with diabetes, not just heart, is also stroke. And when people have mini strokes and may not be aware that they're having them, their personalities can change. So what I would love to say to anyone out there that's listening is, if you notice the changing of a personality of the person that you're closest to who has diabetes, it's not their fault. They're going through things, and also their physiology is changing, and that's probably contributing. So go gentle on them. They're really going through a lot.
Wow.
Go easy like Adele. I couldn't help it. I'm sorry. And I'm not going to sing
I couldn't help it. Oh my gosh. Kim, you mentioned that in your area where you are, because it's about access. This year's theme is about access. That there were not many or at all any institutions set up in where you are for persons who are living with diabetes or needed to be diagnosed as well. Do you think, because Mario says here in Jamaica we do have a number of spaces, but in Florida where you are, can you tell us more about the community where you are, and what your observation has been?
Sure, sure. So where I am in Florida, I actually live in a food desert, right? So research is showing that individuals that live in food deserts that have diabetes, that their blood sugar levels are just through the roof, sky high, because not only can they not afford access to healthcare, but then they can't afford food, period. So I find that utilizing a lot of churches is quite important, because a lot of churches also distribute food. So influencing what they distribute, instead of having them distribute cakes and pies and cookies, I say, you know what? Let's get a bag of beans, because a bag of beans is affordable. Let's get some brown rice, because up here brown rice is affordable. And also let's get some whole wheat flour, things that these individuals may not be able to get on their own. So it really helps when you're passing out food to also address the mental health aspect. So everything that Natalie and Dr. Guthrie mentioned, there's a term for it in the diabetes community, and it's called diabetes distress. And it does not only take into consideration the depression and the anxiety, but diabetes distress is more of an emotional turmoil that someone has when they're being told by their physician that your blood sugars are too high, you're out of control, you're not managing your condition. All of this negative terminology can weigh on the mind of an individual. So instead, when I meet with people, and sometimes I meet with them pro bono because they don't have a penny to buy medications, they don't have a penny to buy food, and I want to teach them, you know what? Let's work with the resources that you do have to get this under control. I always take it from a positive perspective. Just saying little affirmations can help take the stress off and minimize the diabetes distress associated with it. So I say that all to say, for someone that may be in Jamaica or may be in the Caribbean diaspora that is listening, definitely start out with what you can. If that is exercising, if that is sleeping in, if that is finding a church that distributes any type of food sources, take advantage of what you can.
Kim, I had a question for you. As you mentioned taking advantage of what you can or using what you can. I want you to paint a picture for me. Young man who cannot cook, diabetic, and also man in the streets who can cook. What would be easy to access? What would you tell them? So like me now, say I can't cook and I'm a bachelor and I have diabetes and I'm struggling. What would be your advice to me in terms of food choices?
All right, so sure. Are you ready, Dr. Guthrie? Because I think outside the box. I'm not a cookie cutter dietitian that believe in a one size fits all. I
I'm
actually
ready.
think outside the box. So, okay. So this is what I would say. For you, bachelor, you can't cook. What I would say is you may want to possibly visit your fast food establishments. No, I know a lot of people may be thinking, but Kim, fast food is bad. Not necessarily. It depends what you get. So if you're going to KFC, for instance, right? Instead of getting the fried chicken, get the grilled chicken. And then I would encourage you to pair that grilled chicken with a coleslaw because the coleslaw has fiber in it and it also has some fat in it. And then I would tell you, you know what? Get one biscuit, which is your carbohydrate. So from that food group, you have your protein, your lean protein because it's grilled. You have your fiber and some fat from the coleslaw, and you have your one biscuit. That one biscuit is portion control because it fits into your palm.
So in essence, make
So
the
that's
healthiest
really
choice.
Yeah.
make the
control
healthiest
portion.
choice that is
Yeah.
available. Correct. That is available to you. So really, dietitians are not the food police. We're not going to tell you stop eating X, stop eating Y. Instead, we work with you to see what do you have that's available to you and individualize it for your care.
Yeah.
Yeah.
I want to ask this question of all three of you, and if you can answer for me. For persons who believe that diabetes is just with the Black and Asian community, is this so?
No.
No,
Kim?
not at all.
Natalie heard me. Did you
I didn't
hear
hear
my
the
question
last
just now?
part.
For persons who believe that diabetes is only within the Black and Asian community, is this so?
No, not at all.
Right.
No.
And we can see it popping up. It doesn't
Black.
matter your
But we do see a lot of it
Okay.
as well, though, in certain races, though. But yes, it can happen in anyone.
Okay. All right.
Right.
All right. Well, we have some questions. I want to see if our audience have been paying attention. I hope that they have been paying attention because I'm going to be giving away a Amazon gift card valued at $50, and it's a good time. You cannot win it. No, Guthrie, no, Dr. Guthrie, you cannot win it. I'm sorry. It's a good time to have this gift card because Black Friday is coming up. So I'm just saying, if none of you win this, I will be taking it for myself and splitting it $25 each. All right. So my three questions, let me find them back. All right. So I want to give you guys, simple questions based on what we've been talking about.
Big up Rebecca Bissoon in the chat.
Oh, Rebecca is here?
Yeah, Rebecca, give us
Hi,
a heart.
Rebecca.
Hi, Rebecca.
Okay, so true or false, guys? True or false? The first question: eating too much sugar on a regular basis causes diabetes. That
This
is
is for
too
the chat.
simple. For the chat, you can tell me, and we have our social media manager handling the questions over there who'll be able to tell us. If you're answering all three questions, you must answer all three questions. The second question is, type 1 diabetes is the most common form of diabetes. Anybody can answer that? We'll see. Right? It must be the same person answering all three questions, right? Must be the same persons answering all three questions as well. And this other question is, which is not a complication of having too low blood glucose levels? Is it A, being energetic, B, headaches, or 3, lethargy, right? Lethargy. Lethargy,
Ah,
right.
that's so
If you're
nice,
sleepy, sleep. If you want to sleep or you want to just go lie down every minute and tired every minute, that's what
Right,
it means.
yes, what you
right.
mean, you're tired.
You're just tired and pop down every minute. So which of those is not a complication of having too low blood glucose level? I think I know this one.
You know all of them.
I
I
know
think you
this
know all of
one.
them.
I know this one because we don't usually trouble with this part.
All the people in the
anyways,
chats are blowing up.
they're
But guess
blowing
what?
up.
I don't know which questions they're answering. So tell you
Okay,
what,
so
maybe you could
so
put a 1, a 2, and a 3. They
right.
could?
So maybe you could just put a
One
1,
true,
2, 3, and
2
answer.
false,
Give us the answers
3
there.
what? Yeah.
Yeah, give us the answers there as well. Repeat the questions. Okay, so right. So question 1 is, hold on, let me find it back. Lord. Right. So question 1 is, eating too much sugar on a regular basis causes diabetes. This is a true or false question. The second question is, type 1 diabetes is the most common form of diabetes. True or false? And the third question is, which is not a complication of having too low blood glucose levels? Is it A, being energetic, B, headaches, or C, being sleepy, lethargy? Do you have that? So let us know, please. And you could win the Amazon gift card valued at $50. Kim, I'm going to ask you the final question here, and also Natalie and Doc as well. I mean, where can we find you, 1? And 2, is there any last word that you'd want to give our audience as well as we wrap up this session? Starting with you, Kim.
Sure. So you can find me on Instagram mostly. The name is kind of long, but it's the.bloodsugar. With an R, not an H, nutritionist. And my final takeaway point is, I understand that diabetes can be overwhelming. And that's why I encourage everyone, you know what? Focus on what you can control. If you can go to bed an hour earlier, go to bed an hour earlier. If you can include more pak chow and cabbage and callaloo in your diet, include it in your diet. If you can start exercising, definitely start exercising. So focus on what you can.
Absolutely. For sure. I love that. Thank you so much, Kim. Natalie, do you have any words for us, and tell us where we can find you as well?
Absolutely. So again, the best place to find me is also on Instagram at nataliemurray.jm. I echo everything that Kim said about what's in your reach. The other thing that I'd love to recommend is if we can change our culture of reward and celebration, if we can reward our children and each other and celebrate our children and each other in ways other than sugar, it would be a really good thing. So just because your child does well in school, you don't have to take them out for ice cream. You can take them out for a walk. You can take them to the beach. If you want to celebrate your coworker's birthday, you can all go out for a healthy, Island Grill Go Light, your chicken and cabbage salad. You don't have to celebrate with massive amounts of cake.
Okay.
Well, I echo Kim, I echo Natalie, and I'll just end by saying that not only is diabetes manageable, but we have resources right in the space. We have 3 Jamaicans doing 3 totally different fields, and that's right here online. And there are many, many more spaces. So people just need to take the first step, do what they can. We have resources here like the Diabetes Association of Jamaica. We have doctors, health coaches, nutritionists. Take your first step and start small and keep it moving.
Absolutely. Absolutely. I love that. Thank you so much to all of you. I think we did absolutely good today. And just before we go, I want to announce the winner of the challenge. She has gotten for herself her $50 Amazon gift card. So I'm sorry, Dr. Guthrie. No, it cannot be split. Melissa Grant on Facebook actually won it. So congratulations to Melissa. And thank you all so much for joining us, guys. We really, really appreciate the fact that you took time out of your Sunday to be here with us. Let me see. Oh, okay. So more to win later on social media. So on the social media pages and Caribbean, you can go on over to Caribbean Dreams on IG, on Facebook, and also on anywhere else.
They're on Twitter too.
They're on Twitter. Are they on Twitter? Yes, yeah. You are. Okay, but the prizes will be given away on Instagram and also on Facebook, right? Okay. So you can go on to those platforms to win the other prizes, and it includes credits and a whole heap of other things as well, right? Right. Thank you again, guys. This has been so amazing, so informative. Thank you so much to Kim Rose and Natalie Murray, also Dr. Mario Guthrie. Many of you still know him as Dr. Mario Evans, who's going to be performing, I'm sure, at many events come Christmas.
Somewhere.
But as we leave, we ask of you all to please find your balance. I hope that you will utilize the information given to you today and we can be proactive in managing our sugar. And I want to just bring again into focus, because Caribbean Dreams made sure that they had the right ingredients for us to be managing our sugar levels, right? So Caribbean Dreams, they now have the Diabetic's Choice, the cinnamon mint with sativa.
Right, and this is just the cinnamon.
Yeah, and that one is just the cinnamon
Caffeine
as well.
free.
Caffeine free, and it is available on the shelves in supermarkets and health food stores.
And they have whole heap of other
Stevia,
stuff
right?
too. Right, stevia is the sweetener, right?
I was
Which is a
thinking
natural
about another
sweetener.
kind of natural something, but you know what? Stevia. It
So
is.
you just
it is
have to add
incredible.
water. Yeah,
Just add water. It's there. It is lovely, and I can tell you that cinnamon mint, incredible flavor. So it's not just good for you, but it's actually good for the taste as well, right?
They have sorrel, turmeric, and all that other teas to everything.
All either thing.
All
Yeah,
sort of
trust
stuff.
me, we love Caribbean Dreams. They have the hookup. So please make sure that you grab a box. Give it for a Christmas gift. It's a good gift to give.
Yes, it is.
It is.
It
Especially
is.
can buy like
Eat
a
it.
2-month supply.
Buy a
Don't
box.
it? Buy a
case.
whole case of it and give somebody for Christmas. But let's just focus on trying to manage your sugar levels, because we may think at first, it's nothing at all to worry about until we have to worry. And we want to be able to kind of have a handle on that before it gets there. So that's exactly what we wanted to offer you guys here this afternoon, this Sunday. I want to say thank you so much to the entire team who made sure that we had this today. Big up to Charles and Dominic and the entire Caribbean Dreams family. Again, thank you so much, panelists, for being here with us this afternoon. Remember to keep the engagement going online. Of course, Caribbean Dreams, the page is very, very interactive and engaging. So ask your questions. Make sure you follow our panelists online. Ask the questions as well. And we hope that you found value in this afternoon's presentation. It has been my pleasure being your host for today. Please enjoy the rest of your Sunday afternoon. Eat responsibly. Remember the palm size for your Sunday dinner. And have a wonderful evening. Thank you.